Hello, my name is Saad Usmani. I'm the chief of the Myeloma service at Memorial Sloan Kettering Cancer Center in New York City. And on behalf of my co-authors, I'm pleased to present our work on the durability of response with biweekly dosing of Teclistamab in patients with relapsed refractory multiple myeloma treated on the Majestic 1 study. Teclistamab is the first BCMA-directed bispecific antibody that got approved for triple-class exposed relapsed refractory multiple myeloma. In the pivotal phase 1/2 Majestic 1 trial, Teclistamab demonstrated rapid and deep durable response rate with an overall response rate of 63%. And the median follow-up reported in the original paper was 11.3 months at a median follow-up of about 14 months. Now, patients in Majestic 1 who achieved and maintained a response could be switched to less frequent dosing schedule, which offered dosing schedule convenience and flexibility to patients, caregivers, as well as physicians. And in this analysis, we wanted to look at the durability of response for those patients who switched from weekly to biweekly dosing schedule. So as shown in the figure for eligible patients who received Teclistamab at the recommended phase 2 doses, it was preceded by 2 step-up doses. And then in the phase 1 portion of the trial, patients who had at least a partial response after 4 cycles of treatment were able to switch to biweekly. For phase 2 patients, they had to be in a complete response or better for at least 6 months before switching treatment. And then, if we look at the primary endpoint for the Majestic 1 trial, that was overall response rate, with key secondary endpoints being durability of response, PFS, overall survival, as well as safety. So a total of 165 patients were treated at the recommended phase 2 dose, and 104 patients responded. And now we have the median follow-up of nearly 2 years. Of the responders, 63 patients switched to biweekly dosing. Of those, 54 switched that met the protocol-defined criteria of switching, and then 9 switched because of other reasons, which included adverse events or infections, including infections, or physician or patient choice. So the median time to switch was 11.3 months, and the median follow-up since switching was 12.6 months. So if we look at the responses to Teclistamab over time for those 63 patients, who switched, we can see that majority of these patients were in CR or better. Duration of response from the time of first response was not reached, and nearly 70% of the patients who switched remained in the response for at least 2 years from the time of that first response. And as of data cutoff, 42 of the 63 patients who had switched maintained their responses, so 41 of whom are still ongoing with treatment. Amongst the others, 14 progressed after responding and 5 passed away. 1 had subsequent therapy after response, and 1 withdrew consent. If we look at the infections over time, there was a reduction in new onset grade 3 or higher infections over time, especially if you look at the biweekly dosing patients had fewer new onset infections compared to the weekly dosing one. So if I were to summarize, these data, this is the longest follow-up we've had for a bispecific antibody study to date. Most patients who switched to less frequent dosing did maintain deep responses. Of the 104 patients who achieved responses, 63 patients switched from weekly to less frequent dosing, and 41 of those remained on treatment at the 2-year follow-up. Patients who switched to less frequent dosing maintained their deep responses and actually had fewer grade 3 onset infections compared to those patients who remained on the weekly dosing. With these findings, I think the key takeaway is that once patients get to a sustained response, it's okay to give less frequent dosing of Teclistamab, and that's what we are evaluating now prospectively in clinical trials.